So often following an ankle sprain, one of the common restrictions we find is a lack of dorsiflexion. So I'm going to show you a couple of techniques today that you can use for an integrated and an upright treatment approach to resolving this problem. So one of the benefits from treating this position is it's integrated. We're looking at the foot integrated with the knee, the hips and the rest of the body. It also treats the proprioceptors as how they are in normal function. We also get into those functional positions so that we can create meaningful changes to the movements that our patients and clients wish to perform. So to increase Andrew's dorsiflexion today, we're going to ask him just to drive his hips forward like he would in gait. So as he steps forward with his right leg in gait, that drives his a reaction from the top down to then end up creating dorsiflexion of the foot. Now I can then get in there and try and increase his dorsiflexion in a number of ways. I can come on there and slow down his calcaneus to drive some increased stress through the joints and increase that dorsiflexion. I can then also drive his lower leg a little bit faster to try and create a little bit more motion there. Or I may come into the front and then block his anterior ankle and drive his lower leg over it. And by doing this, we're using mass, momentum, gravity and ground reaction force. It's quite easy on me, but it's also what his body recognises and understands, away from the isolated position that we traditionally use on a treatment table or a plinth. So by doing this, we get a bit of a learning effect as well. And as soon as we get out, we can see a meaningful change in movement that we can then go and test on our movement assessment tool. We can then also position Andrew's body in different positions, because we know that he's going to both need dorsiflexion with his hip in internal and in external rotation in his day-to-day function. So I'm going to ask Andrew to place his foot over onto the left-hand side to create some internal rotation through his lower limb, and then I'm going to ask him to repeat that same position. By doing that, we're changing the reaction through the leg, and we'll often find, especially going into our favourite plane, the transverse plane, that we'll often get some more motion than we would typically looking at just dorsiflexion in isolation. We can then repeat this with his leg in external rotation.